Hello and welcome to the Oral Health Podcast. In connection with National Smile Month, we're here to bring you bite-sized discussions from different people in dentistry about oral health on a variety of topics. So today we're discussing some dental health basics and giving you some tips on how to best take care of your teeth. So this episode of the Oral Health Podcast is sponsored by Proenamel. Proenamel is designed to help reharden precious, acid-softened tooth enamel to strengthen your teeth. With low abrasive pH-neutral formulation, Proenamel toothpaste helps protect your enamel while you brush your teeth. So today with me, I'm joined by Dr Ben Atkins, who is the president of the Oral Health Foundation and a qualified dentist.
Morning, Sophie. How are you? Are you okay?
I'm brilliant, yeah. How are you?
Really good, yeah. Acid erosion is one of those things it affects our teeth all the way through our lives and the different periods in our life. Acid erosion can come from extrinsic and intrinsic. Extrinsic is from the outside of the body, things like food and drink. Mm-hmm. Intrinsic is your stomach acid. It's a phenomenally strong acid. So I'll often see patients, if they've got a what we call a reflux problem, having a considerable amount of their tooth tissue lost. It can be over a lifetime with lots of different attacks. It can really destroy your teeth. It really can. And it can be really invasive. So the key thing for patients to do is to think, hold on, have I got heartburn? That could be acid coming from the stomach into your pipe that connects your mouth to your stomach, the esophagus. And that basically puts a small amount of acid into your mouth. So over time, that will attack your teeth. So often what I'll find is people who have got the erosive characteristics, what happens to your teeth, basically, the teeth eroding, 9 out of 10 times they've got some reflux problem. So it's a condition that we monitor really heavily in dentistry. We watch out for the early signs. It can start in childhood. So we do watch out for erosion in children and in then young adults in exam time and that sort of stuff. So it's a condition that has phases, so it's one of the reasons you should really visit your dentist as regularly as we recommend.
Is there a difference in between decay and like acid erosion or just erosion in general? Because I mean, rather naively, I sort of assumed that decay and erosion were synonyms. They were just the same thing. Is that just not the case at all then?
So that's a really good question, and it's often the problem that we have with our profession. We look for these fantastic different words, but sometimes it's taking it to the basic level. Caries it's an attack by a bacteria on your teeth. Mm-hmm. Erosion is an attack by a chemical on your teeth.
Okay, so that's the key difference then. It's just one's caused by bacteria and one's caused by like a chemical reaction.
And that's it, yeah. Don't get me wrong, there is lots of similarities, but for the simpleness, keeping it simple, it's that acid is what is causing it. So the bacteria live on the sugar that you eat, and that they will eat your teeth because of that. And the acid comes from your diet or from your stomach, and that actually directly the acid. So it's how we create that acid, really, I suppose.
So with diet, is there anything in the diet that's causing maybe acid or acid erosion other than just sugar? Like, is there anything else that people should look for?
Sugar doesn't really cause acid erosion. It's things in your diet that you think are acidic. So think about the common cause of acid from outside the body is something like a lemon in a glass of water.
Right. So a lemon water is probably not the right thing.
No, it's you do sit and you sigh because once that enamel has been worn away, you can't grow it back. It's gone. These teeth are meant to last for a whole entire life. So that's why it's so important to use a toothpaste like Proenamel to put like a protective layer onto our teeth to remineralize and work with your mouth. So it's understanding the preventative journey that you can almost eradicate the effects of erosion.
So that's shocked me a little bit. I didn't realize that you couldn't get your enamel back. I just assumed I don't know why I assumed that it would come back. I never considered that once it's gone, it's gone.
It's a fundamental of our mouth. It's why we, as dental professionals, we hold enamel and dentine in such high esteem because unlike bone can grow back, you know? You can lose bone, you can grow back. Whereas teeth are, the enamel on your teeth is a mineral layer. So there's nothing to regrow it. So we can preserve it, we can complement it with toothpastes, we can slow that process down, or we can actually put almost like a sacrificial layer over the top of it. But what we can't do is it's not going to grow back. So if you look at an adult tooth as it comes through into the mouth, different shape totally in a child than it is in, say, a 90-year-old. And that just sort of proves the point that it doesn't grow back.
If someone has like a lot of heartburn and it is coming up into their mouth, is that then a warning sign that, oh, we need to start looking at the possibility that there is some erosion there?
Absolutely. It's one of the key factors that we talk through with our patients when we start to see the signs. We use an assessment called BWE. You hear dentists shouting numbers out all the time in the surgery. The higher the number with the BWE, the worse the situation is. So if a patient wants to understand how my teeth looking, just ask the dentist what it's all about. So we do watch out for those signs and symptoms, but it's really important for the patient to understand what's causing that. So if you've got something like, if you know that you've got acid burn, you're likely to have some sort of erosion in your mouth. It doesn't always happen, but it's a really good indicator that it probably is happening.
Mm-hmm. So if you're noticing, maybe you do think, you're listening and think, oh no, I do actually have a bit of acid reflux, then is that when you should be looking into getting things like Proenamel just to put that extra protection on? Or
it is, but I would always speak to your dentist to make sure you get that examination, that check. But using something like Proenamel, it's a common sense thing to do with our patients. Sometimes there's so many toothpastes on the market, and understanding which is the one for them, and that's why it's critical to say to your dentist, look, is this the right one for me? It is. That's what this product is particularly designed for.
I'm trying to think of the right way to put this. Things like eating disorders and people who have been suffering with things like bulimia and therefore have excessive acid through vomit coming through their mouths, is that something that are we talking like really, really severe erosion, or is erosion, would you see erosion and then think this could be something wider? Or how does a dentist generally navigate that?
Absolutely right. And there is the worry that when you start talking about thinking, it's another thing for especially bulimics and people with anorexia to worry about, oh, I'm going to the dentist, they're going to talk to me and that sort of stuff. It's always worth having conversations with patients, because it might be the thing that helps. We're health professionals. It might be the cause for help that we can then signpost to the correct professional to deal with these things. I think it's so important that, especially with anorexia and bulimia, it's very, very complex condition and needs so much support that what we would generally do is say, look, if you're having lots of reflux into your mouth, then we would help the patient through preventing that getting worse, using a mouthwash after you've been sick rather than brushing your teeth. Because if you brush your teeth afterwards, you're adding to the effect of the acid reflux.
Mm-hmm.
But it's also why you don't brush your teeth after, for me, until about at least 30 minutes after you've eaten.
Oh, right, okay.
Because you've put an acid attack into your mouth, then what you don't want to do is brush those crystals away, because they will. The saliva is phenomenally important, and it will remineralize if given a chance. So for me, if you're desperate, if you've been sick and you want to do something, use a mouthwash. So we're there to support the patient. And other things we can do aesthetically to rebuild the enamel with composite and fillings and that sort of stuff. But let's keep things in perspective, that we would support that patient in getting the help and have a chat with them, and your dentist will make time. And also, it's discussing with the patient that supportive journey, which is what I'm really proud of my profession for. that. Really, we're not there to cure. That's not. We're there for about. I was about to point to my chin to my nose, say just from there to there, but we're on a.
from chin to nose.
Absolutely. But it's really important that you're in a safe environment, that you're not going to be judged, and we're there to support and maintain, because it's a condition that needs a lot of support.
I think you've explained that brilliantly, and if anyone is listening and does have that worry of, I have this issue and I'm worried about going to the dentist, I think you've highlighted that brilliantly, of they're there to help. That's what they're there for. They're going to try and help you, and it's they will do what they can to support you. I think, yeah, that's brilliant. We're getting towards our wrap up time now, so thank you for listening to this episode of the Oral Health Podcast. Today we've discussed acid erosion in a fair amount of detail. We've discussed how it's caused, to watch for things like stomach acid, and if you're experiencing some reflux, what you might want to do to try and combat that. We've talked about diet, we've talked about the difference in between decay and erosion, and also things such as eating disorders, how that can affect the erosion of the teeth, and why it is always important to go and see a dentist, either if you know you have erosion and you want some help with treating it, or if you're worried that you might be starting to develop some of the signs and symptoms. So next episode we're going to focus on gum health, leading quite nicely on from this, so make sure to come back for that. Ben, I don't know if you want to shout where people can find you on social media and things like that. Nope.
I will try to find my handles and all that sort of stuff. I suppose this is showing my true age. You can find me on the old Instagram at Dental Ben. That will be me, or on Facebook, or I think what's my Twitter one? No, I'm sure there's a Twitter in here somewhere. And that is at Ben_Atkins. The best thing to do is find the information out on the Oral Health Foundation website. It's far more interesting stuff on there.
Well, if you want to find our socials, we are at Dental Health Org on Twitter and Facebook. Instagram is at Oral Health Foundation, and our website is dentalhealth.org. I want to thank Proenamel again for sponsoring this episode. We will put information for all of their products in the description of the podcast and where you can go to find out more information. So yeah, that's it for today. Ben, thank you again for joining me today, and thank you for listening.
My pleasure. See you next time.